joint. So this is the only model that you need to know for the joints, and that's very easy. You guys know that the knee joint consists of which bones? Which bones make the knee joint? Femur, tibia, tibia, and the other bone here, which is called patella, right? What about fibula? No, it's not a part of the knee joint, right? So guys, make sure that you know this is patella. This ligament is called patellar ligament. It's easy because you have patella here. This ligament, which is connected to the what is this bone here? Tibia, is called tibular ligament. The other one, which is connected to this one, what is this one?
Fibula.
Fibula is called. That's all, right? That's all you need to know about the knee joint model, Jason. That's easy. Look, patellar ligament, tibial ligament because it's connected to tibia, fibular ligament because it's connected to fibula. That's all. The other thing, guys, that you need for the lecture exam, not the test, but we need to mention it here, are the movements movements of the joint. Huh? So some of them, which are more important, I just mentioned them. You are responsible for them, but not all the things that you have in your lab manual. The first movement, guys, is called flexion. Flexion is when you decrease the angle between two bones in a joint. If you decrease the angle between two bones, you flex, like this movement. This movement is called flexion. Flexion is that you decrease the angle between two bones. By the contrast, when you extend it, you increase the angle between two bones. So, in the joints between the atlas and axis, flexion means when you decrease this angle, this is extension and this is hyperextension. When you look at the sky, you hyperextend your head. Right? The other movement which are important are called abduction and adduction. Adduction, A-D-D-U-C, the rest. Means when you move the limb closer to the midline of your body. This is called adduction. Abduction, A-B-D-U-C, the rest, means when you move the limb away from the midline. So this is abduction and this is adduction. Your knee joint, for example, this is flexion, this is extension. Huh? This is abduction, this is this is abduction, this is adduction. So these are the only things that you need to know. And also rotation, that's easy, is for example in the atlantoaxial joint that you have here, you have rotation, it means that you can rotate your head. You have another one which is called circumduction. In some of the joints like the shoulder joint, you have circumduction, it means that you can make a complete circle here, we call it circumduction. Alright, these are the movements that you need to know for the lecture exam, not the lab test. In the lab test, of course, I'm not going to dance for you. Right. Test on Monday. Tests are which part? Number one, you have two slides that you need to know. If you remember, they are the slides of the compact bone and spongy bone. Remember them? In compact bone, make sure that you know what are the Haversian system or osteons. You can distinguish the osteon. In the center of the osteon, you have what? Central canal. Around the central canal, you have the rings. What's the name of the rings? Lamella. Then between the lamella, you have the spaces. The space is called lacuna. And between the lacuna, you have the very tiny canals, which are called canaliculum. Make sure that you know this structure. In the slide of the spongy bone, at first you should distinguish that this is the spongy bone. Then make sure that you know where is the lamella and where are the spaces that you have between the lamella. That's all. Then you have the models of the bones. In the model of the bone, make sure that you know this is the periosteum, the layer which covers it. Here you have the osteons. In the center of the osteon, you have the central canal. Around it, again, you have the lamella with lacuna. These ants are what? Osteocytes. These are the osteocytes. This kind of the bone that you have here is spongy bone. So remember, the vertical canals here are central canals. The horizontal one are perforating canals. You're already ready. That's good. All right. So this is the bone model that you have. Then you will have different kinds of the bones on the table. I'm going to ask you about the kind of the bone. When I ask you about the kind of the bone, I'm from the for example, I put the femur here for you. I'll ask you about the kind of the bone. I mean, is that the long bone, a short bone? You can come the long bone, short bone, a flat bone, irregular bone, sesamoid bone. Remember different kinds of it. So I may put the femur for you. Ask you about the kind of bone. You will tell me that this is the. If I put the carpal bone, ask you about the kind of the bone. You will tell me that short bone. If I put the scapula, you will tell me that this is the. If I put the vertebra, you will tell me that this is the. So you will have 2 or more questions about the kinds of the bones. And also, you will have the hot, long bones. You are going to tell me about the parts of the long bone. Remember this part? Two ends which are called epiphyses. In the middle, you have diaphyses, and around it, you need to know where is the location of periosteum and endosteum. You cannot see the periosteum and endosteum, but you need to know the location, right? You need to know that in the center of the diaphysis, you have the medullary cavity. Know that inside the medullary cavity, in the fresh bone, you have the yellow marrow. Make sure that you know what is the nutrient foramen, all the foramina, all the openings that you have on the diaphysis may be the nutrient foramen. All right.
How many questions?
How
many questions?
I think 2. Make sure that you know where is epiphysis, where is diaphysis, and where is metaphysis, the part which joins the two together. And make sure that you know where is the epiphyseal line.
Right. How many questions in total?
50, as usual. There. Then you have all the structures you need to know in the axial skeleton and the appendicular skeleton, all you have in your handouts. Just the parts that you have in handouts, not more. Make sure that you know the names of the fontanelles in the fetus skull. What are the fontanelles? So make sure that you know you have the anterior, posterior, anterolateral, posterolateral. You know the names of the fontanelles. And then make sure that you know all the parts that you have, all the bones that you have in the skull, vertebral column. About the vertebral column, make sure that you can distinguish atlas. I will put the atlas for you. You need to tell me the name, the specific name. Don't tell me that this is C1. That's not enough. Give me the name. Atlas, axis. Make sure that you know that the dense process and you can distinguish that this is axis. Make sure that you can distinguish between thoracic vertebra, cervical vertebra, and lumbar vertebra. I will put all of them for you on the table. You will tell me that this one is vertebral, this one is thoracic, this one is cervical. Right? Make sure that you know the parts of the vertebra. You know where is the body, where is the vertebral foramen, spinous process, transverse process. Make sure that you can distinguish between the superior and inferior articular surfaces. They are important because in the test you get confused. You are like this. You don't know which one is superior, which one is inferior. Make sure that you have the body facing you and the spinous process at the back. So what you have at the superior part is superior. What you have at the inferior part is inferior articular.
Would you be asking us parts of the vertebra?
Of the vertebra, of the typical vertebra. You need to know the parts of the typical vertebra. And all you have about the skull in your handout, make sure that you can distinguish, you can identify all of the foramens. I'm going to put the pipe cleaner inside the foramen and put a number on the pipe cleaner. You can move the bones. You can look at the skull at the different aspects, but make sure that finally, this is for example jugular foramen, right? Make sure that you can find all of the facial bones and cranial bones and the parts you are responsible for. You know about them in your handouts, the parts that you are responsible for. And finally, the bones that you have in the pectoral girdle, pelvic girdle, upper limb, and lower limb. Any question? All right. So guys, go over all of the parts that you have in the handouts for tonight. Make sure that you know them. If you have any question, please ask. Don't hesitate to ask. Any questions?
Should be 6 through 9 or chapter 6 through 9.
6 through
10.
Today was 10.
I'm not sure about the numbers, but that's just about the bone. Whatever you have about the bone.
No muscle?
Bone tissue, no.
Okay, good.
Not for lab.
Not for okay.
Not for lab. We are talking about the lab.
Okay, lab, okay, so for the lecture.
For the lecture, you will have more.
Okay.
For lab.
Like that.